Tonight, the U.S. is rolling out new requirements for international travelers. On November 8th, anyone can travel here from outside the country as long as they're fully vaccinated and test negative within 3 days of their trip. For unvaccinated travelers, you have to test negative the day before. You don't have to show proof you're vaccinated if you're under 18 years old. The new rules mean some people are coming from countries where they may have gotten a COVID-19 shot that hasn't been approved in the U.S. yet. 10 Tampa Bay's Angelina Salcido found the new guidance should work, but the kind of vaccine each passenger gets will definitely make a difference.
The crowds are growing. More and more travelers are getting comfortable flying.
We are trying to stay fully staffed and make sure that we have all of our shops and restaurants open. We're able to manage the bigger crowds.
Emily Nips with Tampa International Airport says at least 60,000 passengers are coming through here every day. They should see around 80,000 a day over the next few months, and getting international passengers back will add to that number.
This is a really big deal because it helps clarify what the rules are.
Doctors say the Biden administration's new guidelines for international passengers are a step in the right direction because the proof of vaccination is actually going to be required. What could be a concern is the efficacy of the vaccine they've been given.
That actually is a legitimate concern.
Dr. Jill Roberts with USF Public Health says the vaccines used abroad are likely different than those given here.
There's a Sinovac vaccine, a Sinopharm vaccine, and there's also AstraZeneca. What they're ruling out, notably, is Sputnik vaccines. It doesn't actually have a clear amount of data demonstrating that it works.
Data shows the efficacy of each of the vaccines is less than 80%. Sinopharm's vaccine is 79% effective, while AstraZeneca is 63%, and Sinovac's is 51%. Even still, Dr. Roberts says the likelihood someone overseas would bring the virus here is low.
The argument would be the other way around. There'd be travelers from the United States that actually would take COVID to other countries because we're still a major COVID country.
And Dr. Roberts says the new rules still apply for Americans traveling internationally. So unvaccinated Americans coming back home will also need to get a COVID-19 test the day before their trip.
And like we said, Americans under the age of 18 won't have to prove they're vaccinated. But let's take a deeper dive into some of the other exemptions here. Travelers who are non-tourist visas or non-tourist visas coming from 50 countries that have a vaccination rate of less than 10%, they will be exempt. Most of those travelers will have to get the shot within 60 days of getting to the U.S. There will also be exemptions for certain COVID-19 vaccine clinical trial participants and people with certain medical conditions as well.